Have you ever wondered how ice and heat work for pain? Worse yet, have you ever wondered why it doesn't work for pain? Well, you're going to want to watch this. Hi, everybody. I wanted to share some facts based on a talk I did a few years back at a conference. I retitled this a little bit because we've recently been talking about relieving symptoms versus resolving the cause. And we really want pain resolution, right? We don't just want symptom relief. Yes, we want symptom relief, but kind of tongue in cheek, if somebody's hitting you with a hammer, you can take a pain med to try to alleviate the pain and get some relief from the symptoms. But wouldn't you rather stop getting hit by the hammer, right? That would resolve the cause. So that's what we're looking at here. Unfortunately, a lot of the times conventional treatment for pain, which is the most commonly advised or recommended or used or known, tends to be more symptom relief. And I'm going to show a couple slides here. So a lot of us are very, very familiar, if not everybody on the planet, very familiar with the fact that you can use an ice pack or a hot pack when you have pain. And yeah, if you sprain something, you use ice. And, if you pull a muscle, you might want heat. But sometimes you might want ice, especially if a muscle has a lot of spasm. And sometimes ice and heat can be really, really effective. But if they worked 100% of the time, there wouldn't be all kinds of people on the planet experiencing pain that they can't alleviate, right? So I want to show you a little bit about why and how they work, and then a couple reasons why they don't. So the scientific term for a pain nerve cell in your body is a nociceptor. And your nociceptor's job is to report problems to the brain, whether you're at risk, whether you've been injured, or are you having pain. We can get some really noxious stimuli, right? I mean, it can be really nasty, like an open flame, or maybe some horrible bleach, and you're smelling the bleach. I mean, just something really noxious. Your nociceptors are really good at reporting that. They're also really good at reporting damage when you've been injured. Now, of course, if you've got nerve injury, then you may not, receive the message because of the injury to the nerve. But for the most part, if it's working, it's going to let you know that something's harmed. You've been cut. You've been wounded. Okay. And then we've got inflammation. Now you've got your observable inflammation like redness and swelling because of an infection, or you can have chronic inflammation, which isn't necessarily visible to the naked eye, but can still get those nociceptors to tell your brain, we're not so happy here. This hurts. Okay. Now you've got three different types of nociceptors. You've got your C fibers, and they communicate very slowly. They don't have something called a myelin sheath, which really speeds up the transmission of the message. And then you've got your A delta nociceptors. They do have a myelin sheath. They work really, really fast. And then you've got something called a silent nociceptor. And they only respond to quite extreme or intense stimuli. And I'll be doing a couple of videos moving forward to show you a little bit about those. But for today, I want to stick with the C fibers and one specific, very specific particular job that they do or that they respond to. And it's called thermal response. So a C fiber nociceptor will report a change in thermal activity. So if something heats up, if something cools down. So if you apply heat or ice to something, then guess what? Hot water bottle, a cold pack, ice pack, the C fibers will report that, this is better. They're reporting the change in the thermal activity, which kind of keeps them from reporting the pain, right? And sometimes because of the change in the tissues, because of the thermal activity, it will also tell them to say, oh, the pain is better. Now, the question is, why does treating pain with modalities like heat and ice not succeed every time? Why is it sometimes it's kind of like a Band-Aid, but it doesn't fix the problem, right? You're treating a symptom and it's not fixing the problem. Now, we've also got, why is it that we've got multiple professions that we have access to? You know, you can go see your primary care physician, your medical doctor, your doctor of osteopathy. You can go to see a nurse practitioner, a physician's assistant, an orthopedist, a pain management specialist or expert, a neurologist, a neurosurgeon. You can see a PT, an OT, a chiropractor, a massage therapist, even a personal trainer, depending on their skill and their expertise and their experience. They may be able to help you to work around something that's bothering you and keep doing your workouts. But you could have the same problem and see all these people, and they're all going to use a completely different hammer, right? Physical therapist might put ice or heat on your problem. They also may be teaching you some specific exercises. They may have some training in manual work. But my point here is we have a lot of different professions. We have a lot of different modalities. So why is it so many people have pain? Why is that? It doesn't make sense, right? Why wouldn't you want to ask the question? Well, I did a video not too long ago where I talked about the fact that 7 out of 10 people who have low back pain, nobody knows why they have it, including the person. Now, sometimes it's, yeah, I fell, I landed on my backside, or I pulled a muscle lifting something too heavy. I mean, they know, right? But 7 out of 10 times, we don't know. The exact cause is unknown. Nobody knows. So is that the reason that all of these professions and all these modalities don't work? That still doesn't kind of make sense, right? Because everybody's got their knowledge and their skill set, and modalities are meant to work when they're applied appropriately for the right reasons. So why is that? So what's missing? There's something going on. There's a puzzle piece missing, right? Are we not asking the right questions? I just want to give you a moment here to think about this. Are we not asking the right questions? What's missing? I have a very simple answer that I'm going to give you. We treated a body part and we forgot about the whole person. We treated a symptom. We treated a knee. We treated a shoulder. It doesn't matter how we treat it. You could tape it up. Sure, it might make it feel better, but you've got 18 muscles that directly impact shoulder function, only 4 of which are the rotator cuff. And then the whole rest of the body indirectly impacts shoulder function. Your knee is a victim of the hip above and the ankle below. You've also got a trunk that has to rotate, which alters gait radically if it's not rotating properly, which can stress your knee. So we can put modalities like heat and ice on here till the cows come home. You can see 8 different professions, but if they don't understand authentic human biomechanics and how everything impacts everything else, the same with your back. If they don't understand, the silent saboteur, if they don't understand that muscles in your body work according to the context of how you're using them, if they don't understand physics, ground reaction force, gravity, mass and momentum, and how a muscle can work completely differently in one task versus another, and different body parts impact other body parts differently depending on the task you're performing, these things need to be understood in order to resolve the cause of pain. I look forward to doing a couple of more of these, and I look forward to hearing your comments. Thanks for watching.